The Pest and Vector Control Association of Ghana, formed in March 2020 and currently with over 150 member companies nationwide, aims to bring together the various industry players to ensure standardization and help improve their operations through capacity building, while solidifying the efforts of state agencies to combat the increasing spate of pest and vector infestation in our country. The executive chairman of the Jospon Group of Companies, Dr. Joseph Sianwe Japan, who doubles as the national president of the association, underscored the need for such a body.
We need to remind ourselves that COVID-19 and the related viral disease are not going to vanish overnight. Therefore, we must have sustainable strategies to deal with the situation. We need to continue to plan and coordinate our responses post-COVID-19. Just as the workplace needs to be disinfected, homes also need to be disinfected, schools need to be disinfected, and other public places, and in short, everywhere must be disinfected. It is imperative for us to hire professional company which has the staff and also the requisite training, certification, and proven track record, as well as EPA certification. That is why the association has been formed. Our ultimate goal is the protection of Ghanaians.
The guest of honor, the Minister for Health, Kweku Agyemang-Menu, used the opportunity to comment on the controversial arrangement to acquire the Sputnik vaccine at $19 per dose instead of the original $10 price.
When there is fire, we don't talk about how much it will cost us to put water on the fire to quench it. But when the fire goes down, we begin to count how much did you spend on it. Over the last weekend, I have been a subject of ridicule in this country on some media platforms for signing an agreement to procure Sputnik V vaccine. What I've gone to try to procure vaccines to vaccinate our people, only God knows how I have suffered. Time will tell my story. And those of us Ghanaians who are castigating me, I have a philosophy that when things must be done, they should be done when it is timely and when it is very necessary.
The health minister also shared an emotional insight into the controversial Sputnik vaccine arrangement.
Even at $19, we still have not received a single dose of that vaccine, apparently priced at $19, when our LC delayed for just 300,000 doses. After confirmation, the seller told us that he had run out of stocks. How much did he sell that vaccine to other people? Said that we couldn't get a single dose at $19. We are not thinking about that. But I had an obligation to try to see how we can arrive at our head minute. When we started looking for vaccines to procure, intermediaries were not part of our agenda. Somebody outlined it. We were looking at what we were going to get from COVAX, the WHO unit that was going to supply free for 20% of our population. The AU had set up another platform that was going to try to procure bulk and sell a bit cheaper to African countries. We call it African Medicine Supply Platform.